Hello everyone, this is Dr. Feiz here, and I wanted to explain why it's so easy if you've had a sleeve gastrectomy and it's not working, how to change it very easily to the strongest weight loss operation that we have, which is the single anastomosis duodenal-ileal bypass, also known as Sadi. If you can look over here, this is the stomach. The stomach is not responsible for a lot of absorption and digestion, but it is essentially a storage tank. It holds food. So the first thing we do in the Sadi operation or in the sleeve gastrectomy operation is cut and tubularize the stomach so that it goes from a big sac down to a narrow tube that holds about 100 to 250 cc's. That is the end of the sleeve gastrectomy operation, but in the Sadi operation, we're not only doing a reduction of stomach, but we're also going to change your absorption. Now, this is the normal anatomy, and as you can see, after the stomach is the pylorus, and then there's the small intestines, which is where all the absorption and true digestion happens. That's why there's so much of it. It's like a conveyor belt. As the food moves forward, it gets digested. So what we do in the Sadi operation, which is very, very unique, is that we make one anastomosis. We count backwards about 250 centimeters from the end of the small intestines, which is the large intestines or the colon. We count backwards and we attach it so that the food goes into the reduced stomach, the sleeve, and then into the last bit of the small intestines, thereby bypassing most of the small intestines absorption. This is why this is the most powerful weight loss surgery that we are commonly doing today, because you only have 200 centimeters of absorption left. We're bypassing the other 400 or so centimeters. This not only means that you're going to eat less, but you are going to absorb much less of the food that you eat, and once it gets into a large colon is where absorption ends. Small amount of small intestines means you're going to absorb less of the calories that you eat. Great revision surgery from a sleeve gastrectomy if necessary.